I invite Silvia Meneghello, that is Head of Communications at CNAO, so another one of my bosses. And she's going to discuss and present about caring for cancer patients, the CNAO social approach. Please, Silvia, have a look to the time, and you have 20 minutes. Thank you.
Okay. Thank you, everybody, for being here, and thank you so much for the organizing committee for giving me the possibility to talk about a special aspect, the CNAO social approach in caring for cancer patients. Let's go through the summary of my presentation. We will see an historical overview on welfare services in oncology. Then we will go through the CNAO social approach. We will focus on pediatrics projects. We will see the role of patients' associations, and we will see the ongoing initiatives and future projects, ending with the benefits of a social and welfare approach for patients. Let's go through a historical overview on welfare services in oncology. Beginning the early 20th century, oncology has been recognized as a distinct medical specialty. Then in 1950 and 1960, we have the recognition of psychosocial needs and the introduction of support groups and counseling services. In 1970 and 98, we have the holistic approach to cancer care thanks to multidisciplinary teams. Arriving in 1990, we have the integration of palliative care with the focus on symptoms management and quality of life. Arriving in 2000, we have the development of survivorship programs, and finally, we have in 2010 the personalized patient-centered care. What is the pillar for allowing patients to have an access to healthcare services and advanced treatments? The first is a website which guides patients through a simple tool through which they have the possibility to send us their first clinical assessment. And in this way, we give to our patients the possibility to have a funnel in order to send in a very easy way their clinical documentation. Speaking about mental health, it is really important to give to patients psychological support. So we organize free psychological support services at all stages of hadron therapy treatment, dedicated to patients, family members, but also to our clinical staff. And since 2018, we have followed 1,000 patients, improving disease response and reduces stress and depression. Talking about psychological support, we organize also experiential patient groups with the supervision of the psychologist to deal with the fear and claustrophobia related to treatment. Community support is really important. We organize events dedicated to patients and their families to provide educational and social well-being beyond illness. Last year, we do something special for our patients. It was I'm a Pearl of Beauty, and it was an event dedicated to head and neck cancer patients. In these events, patients met also an expert in corrective makeup who teach them the camouflage of the scars. And this year, we have performed also cancer and sexual pelvic floor rehabilitation sessions, because it is a problem to be faced with no hesitation. And this year we had portraits of women that is a rebirth defile for patients who turned into living sculptures. They were dressed with hospital sheets, and in this way they become living sculptures, and the sheets lose their significance related to illness and reverse in something new. We also organize supporting programs dedicated to parents, thanks to the collaboration with Oscar's Angels Italia. And last year, parents of our children were at Bruce Springsteen's concert, and this year they were also in Rimini at the Glory Days. Inside CNAO, we organize installations. This is Wands of Light, women portraits of their melanoma scars, enhanced in gold, a special light of their courage and their strength, a strong reference to the Japanese technique of kintsugi that enhances the cracks in objects by making them unique. Another installation is made with Body Art Therapy Italia Association. It was body art interventions on women submitted to surgery for cancer to make them experience the feeling of a new body healed and relieved by the art therapy. Let's have your attention for this intervention, very particular and it's designed exclusively for now. It is wishing well. Wishing well is something that allows to patients, caregivers, and also CNAO staff to leave a message of hope that flows in the bottom of the well. We have organized this architecture intervention with Medicinema, and as you can see in the left photo, the well is inspired by the shape of CNAO treatment rooms in order to make the treatment less impactful and difficult and as a part of humanization technology. With this installation, patients can wish and witness wellness to new patients. We also think about education programs. We organize guided tours of our facility in order to let the patients discover the heart of our facility, the synchrotron, and better understand also hadron therapy. Now I would like to talk about what we do outside now. We do not forget our patients when they are outside now. We organize cultural visits that simulate cognitive functions and engage the mind, providing them positive distraction from illness. And we organized activities group to foster social interactions among patients and help them fight loneliness. We would like to focus on some special patients, our pediatric patients. The diagnosis and treatment of cancer can be extremely stressful for children and their families. So we have to build spaces designed for children, help to maintain an impression of normalcy. We have to support family with adequate spaces that allows them to follow the children and stay close to them, offering not only practical but also emotional support. With these projects, we welcome our patients and our families in an environment, a positive environment that encourage the adherence to treatments. The foundation of an effective and human healthcare is with no doubt the relationship with our patients and the health personnel and the staff, the clinicians. The ability of our physicians and health staff to build an empathetic and understanding relationship with patients results in better adherence to treatments, often superior clinical outcomes, but also to greater satisfaction of our staff. The role of the ecological child is really important. So we need the treatment pathway as child-friendly as possible and organize leisure time for children and their families. We decorated pediatric masks and soon we will have an educational video for our children that we are doing with YED, the European Institute of Design, that will help children to explain them the treatment. In this frame, the role of patients' associations is really important, not only in terms of fundraising, because having patients' associations involved in our projects help us to raising awareness, to build a community, to provide information, and to support patients with counseling and educational workshops. We do these are some projects we have already realized. The waiting room for pediatric patients. We have also made an important fundraising campaign that allow us to support housing costs for pediatric patient families. And let me have your attention in this new project is the immersive city room, and the purpose is the humanization of the city room with the benefits of making the patients, the little patient, more cooperative and reducing often the time of sedation. Let me show you the video of this. Can you help me, please? This immersive city room. No, I can do it. Okay. Fine, don't worry. I will do.
C'è un luogo dove regna l'immaginazione. La forza che tutto rende possibile. Noi vogliamo sempre vederli sorridere.
Thank you. Just going on with the projects for pediatric, we will have spaces for the waiting room and they are dedicated to kids and teen, and we will have a relax area, a nursery area for moms, and of course an area dedicated to school in hospital, just in order to not leave the patients alone and go on with educational projects. In conclusion, let me stress the benefits of social welfare approach for patients. First, we have seen the access to care, and this fosters a sense of control and engagement in their care. Regarding mental health, we reduce stress and depression in our patients. With exposure to art, history, and nature, we stimulate cognitive function and reduces feelings of isolation and depression. We give them a sense of normalcy, participating in group outstanding, and helping them feel a sense of normalcy and enjoyment in their lives. We build social connection with groups activities, helping patients build supportive relationship and combat loneliness. And we have seen the education and attainment, better understanding of disease. This results in a better adherence to treatments and superior clinical outcomes. If I have time, I will show you a video, but I think the video is 3 minutes long. If I have time, I would like to show this video. Because, okay, thank you.
Thank you. Thank you.
Thank you.
These were patients, of course.
Yes, there were no models. There were patients with the hospital sheets.
Questions, comments? Maurizio, please.
Okay, thank you. So I'm amazed. Congratulations. I mean, really, what you do is really wonderful. I mean, for me, too, it was the most interesting presentation for the workshop so far. Okay, apart from this comment, so my question is, there was a comment in one of the slides about humanizing the relation with technology. I mean, what is the perception that people have about the technology, and what can we do to improve it, to help it? Is it positive, negative?
They have two kinds of perception. I think that they fear the technology, and so we have to show them what there is behind the wall. So this big machine, the heart of the child, synchrotron, has to be shown to the patients. And in this way, they really have the feeling that be followed by something impressive, by something that will, with no doubt, save them. Let me say save them. And I think that educational attainment and guided tours for patients, but also installations inside our center has to driven the attention to this item. We have to help them feel comfortable with the technology.
Thank you, Silvia, very much for your presentation and your fantastic work you do. Well, a question about evaluation, but not in technical terms. I would like to ask you if you have a mechanism, a tool to evaluate the social impact of your actions to your patients, your research team. And of course, again, not in technocratic terms. I mean, even the smiles of those people, I know it's the true impact of your work. But if you have a methodological tool to assess how all these approaches have an impact to your community.
Thank you for your question. I think this is very important. And we will surely implement a questionnaire that we will give to our patients after cultural visits, after events, in order to collect their impressions and always offer better organization ones. What we do now is what we see on our social profiles. On our social profiles, our patients always leave enthusiastic messages, and this is what we find that we are in the right position. And these messages are important also for building community among patients and outside, and spreading also the knowledge of aromatherapy.
Thank you very much. Let's thank the speaker again.
Just one more minute, please.
Yeah, here closes the session in this room, but I just wanted to remind you that in the main auditorium, Professor Roberto Orecchia and Arnold Campos are giving a presentation in the framework of the Aristotle Medical Forum in the session of the role of artificial intelligence in radiation therapy. So I encourage you to just step in the main auditorium. Thank you very much.